Good afternoon, folks. Now, discussion C deals with a narrative on dementia crisis. Okay, so I'm going to discuss that for you for C. So give me a few minutes to set up for the show, please, and I'll be with you. Okay? Chair, members of the committee, thank you for the opportunity to speak today. I come before you with a simple truth. Dementia is already one of the most expensive and debilitating conditions in American life. And the burden is not failing where most people think it is. According to the latest national modeling, dementia will cost the United States $818 billion in 2026. But only a fraction of that cost shows up in Medicare claims or Medicaid budgets. The majority is absorbed quietly, invisibly by families. The real cost is not in healthcare system. It's in the home of that 818 billion. 320 billion reflects the loss of quality of life for people living with dementia. 237 billion is the value of unpaid caregiving. The hours of lifting, bathing, crewing, redirecting, and supervising that keep people safe. 23 billion is lost earnings as caregivers reduce hours or leave the workforce. 222 billion is formal medical and long-term care, much of it paid by Medicare and Medicaid. When you add these pieces together, a picture emerges. Families are the primary dementia care delivery system in this country. They are doing the work of a workforce we do not have. They are doing it without training, without pay, and often without rest. What this looks like in real life, every clinician in this room has seen it. A daughter who leaves work early 3 days a week because her mother can no longer be left alone. A husband who sleeps in a chair because his wife wanders at night. A son who spends his lunch breaks on the phone with pharmacies, insurers, and home health agencies that cannot find staff. These are not edge cases. They are the backbone of dementia care in America. Why this matters for lawmakers. The, the 818 billion figure is not just a number. It is a map of where the system is breaking. Families are carrying the largest share of the burden. Medical spending is not the main driver. Disability and caregiving are. Workforce shortages are not an optional or operational inconvenience. They are a structural threat. Quality of life loses dwarf medical costs, reminding us that dementia is not only expensive, it is profoundly disabling. What lawmakers can influence. While I cannot recommend specific uh, political action, I can describe the areas where policy decisions have the greatest impact. Strengthening the direct care workforce, because without aides, home based care collapses. Access to home and community based services, because most people with dementia want to remain at home, and doing so is often less costly than institutional care. Care models that reduce avoidable hospitalizations, because dementia related crisis is often stem from caregiver exhaustion, not medical failure. The choice in front of us dementia is not a rare disease. It is not a niche issue. It is a predictable growing parts of demographic future of every state. The question is not whether we will pay for dementia care. We already are. The question is who pays and what at what cost to their health, their employment, and their stability. Families families are doing everything they can. Health systems are doing everything they can, but without structural support, the burden will continue to shift toward those least able to absorb it. The 818 billion estimate is not a warning about the future. It's a description of the present. And it tells us that dementia is not only a medical condition, it is an economic force, a workforce issue, and a family level crisis. Thank you for your attention and for your commitment to the people living with dementia and the families who care for them. Okay, guys, that's your tea. And we'll be back on after dinner. Till then, Gator Wellness, take care, folks.